Do you think this breakdown is due to dependency on phone calls, email, spreadsheet, and manual follow-ups?
Central solved that problem. And the idea that in the system like Epic, CERN, or Meditech, where they're operating every day, or in nursing homes like point-click care EHR systems, we've embedded an easy launch button that they can order an ambulance right from there. They hit the button, we get all the demographic information.
Welcome to Better Tech Health, the podcast where we explore how tech can make healthcare operations smarter, faster, and easier for people actually doing the work. I'm Mohammad Atif, CTO of Biologics, where we build custom healthcare and enterprise technology solutions focused on solving real operational challenges. Today we are discussing a critical part of the patient journey that discussing about from discharge to destination, digitizing the patient transportation. To discuss this, today we are joined by Mr. Todd Sheridan, a vice president at Ryde Center. Todd brings more than 2 decades of leadership experience across fire, EMS, and healthcare system, including senior executive role where he has large-scale operation, dispatch and transfer center development, system integration, potential turnarounds, and operational redesigns. What makes Todd's perspective especially valuable is that he understands patient transportation from both sides, the frontline urgency of EMS and the executive challenge of building scalable, accountable healthcare workflows. At Ryde Center, he's helping healthcare organizations move away from phone calls, spreadsheet, incomplete forms, and disconnected vendor towards a more automated, visible, and data-driven transportation process. Todd, welcome to Better Tech Health.
Thank you for having me here. Really appreciate the opportunity to speak with you today.
Thank you, Todd. So, Todd, before we discuss the details, can you walk us through your journey? How did you get into this space, and what keeps you motivated on a day-to-day basis?
I'll say this, getting into this space was actually kind of a journey for me as well. I came from being a firefighter paramedic for many of years, and then I had the opportunity to transition into a role where I used to go around and help manage different ambulance companies or hospitals with their transports or their transfer centers, helping with patient management, placement, throughput, really dealing with troubles ever since all hospitals started really coming together into bigger systems. Got into Ryde Central here last couple of years because from the transport world, I felt like my Achilles heel, and the CEO of Ryde Central, where he owned the largest ambulance company in Texas, our Achilles heel was sharing data transparently between all parties, but then being able to have all parties on the same sheet of music. And if you think about ordering a pharmacy medicine, right, just in a hospital, a case manager or nurse or whomever can go in and just order directly. Why couldn't they do that for ambulance companies? Why do they have to pick up the phone? Why are we still using paper and pen? And that just bred the idea of how could technology help solve this issue. And then we've, really grown in the space of how do you take that technology, the logistics, the automation, and bring that together to really help all, hospitals with their transport and throughput challenges.
Great. Awesome. So tell us about Ryde Central, like how it is solving this problem, what the day-to-day operations look like, and how you guys are operating overall.
Every day, caregivers, I'd say, are asked to do more with less.
Mm-hmm.
Ever since COVID, every nurse, every case manager is asked to do more with less. If we could take a little bit of that burden off them, what now takes them to order an ambulance, 30 to 60 minutes, they're picking up phone calls, they're Rolodexing to try to find somebody to do something in time, or they're dealing with all that paperwork. Really, if we could take that burden off of them and automate it, that was really our goal. And then on the flip side, the transport companies, being able to have to take phone calls, they automatically get the transports. It's brokered out to the right vendors based on contracts, expected payment, performance. Doesn't matter if it's air medical, ground ambulance, wheelchair, sedan, ride share. If we could do that, Ryde Central solved that problem. And the idea that in the system like Epic, CERN, or Meditech, where they're operating every day, or in nursing homes like point-click care EHR systems, we've embedded an easy launch button that they can order an ambulance right from there. They hit the button, we get all the demographic information that we need, and then from that demographic information that we need, then all the caregiver has to do is answer information about the clinical data, and then we broker that out to the transport vendors where it can look directly into their dispatch software, send back the right amount of times, or send it to Uber and Lyft, They can send back the times, and everybody can track each other. GPS locations, share data, chat between all functions, do all of those pieces. So Ryde Central has integrated, as I would say, kind of a middleware to automate all of that transport process.
Awesome. So you mentioned about like ambulances and also Lyft and Uber. So do you guys work with specific vendors, or do you guys have your own fleet as well in parallel?
We don't do our own fleet. We're kind of agnostic in that space. We just want to be the group that brings all parties together. Right? We want to be able to ease the path for that side of it, thinking, it's already hard enough on the hospital side. Their specialties are specialists in what they do, right? Ambulance companies are specialists in what they do. We just want to be that specialist that brings everyone together and makes it operate seamlessly for all parties.
Got it. Yeah, so can you, Todd, walk us through a typical transport workflow from discharge approval to final destination, and where does the process most commonly break down?
Today, I would say a lot of times it all breaks down in the idea that we are asking somebody that's doing patient care to be a billing expert and a transport expert. And they didn't go to school for that.
Mm-hmm.
We're asking them to understand maybe health systems contracts, who they should be calling first, second, third. We're asking for them to understand what insurance companies need what forms. We're asking them to follow CMS rules, and they may not know that. What we've done is the idea that what could break down is not getting the right form. So ultimately, the ambulance company bills back the hospital or the nursing home for payment instead of the insurance company, or instead of Medicare or Medicaid. We automate that form creation process, electronic signature within our system. We already have dedicated workflows. We make it so it eases the path. We make it so they don't have to stay on the phone the whole time, because maybe they're being pulled 10 different directions, have to hang up, come back, or one company says they'll be there in 5 hours, but they need them out in like 2, and they're just constantly Rolodexing. Those breakdowns happen all day long because our caregivers are getting pulled in 10 different directions, and they're not able to do something that should only take them 30 to 60 seconds. So we take all that time, all that distractions, everything that they shouldn't be expected to be a medical discharge, a medical transport expert, or a medical, billing expert. We automate all that process for them so they can just do their jobs that they need to do. And all they have to do is hit a button, fill in 30 seconds worth of information, and we handle the rest.
Got it. And do you think this breakdown is due to dependency on phone calls, email, spreadsheet, and manual follow-ups?
I always say software helps take care of all those transactional items that we as humans are fallible on. So if you think of it that way, right? All this transactional stuff that we do that doesn't require humans, software in some way, shape, and form most likely can solve that. Ryde Central's leveraging that to take those things that are cumbersome, transactional work that could be taken off their shoulders to help fix that really process. So yeah, it breaks down the moment a human has to get involved or there's guesswork on something that could be automated. Absolutely, there are breakdowns there.
Got it. So Todd, walk us through the complete digital patient transport workflow. How does the Ryde Central help, starting from requesting the ride to then calling the vendor? And you also mentioned you guys have a GPS real-time tracker as well. So for our listeners, give us a complete high-level overview that how does it work end to end?
Yeah, so right where the caregiver's working in their in their patient care record, they'll be able to click an icon right in their patient care record, and they'll be able to fill out information just like they would, filling out a note for any patient or services they need within the hospital. Once they submit that, which again takes 30 to 60 seconds, we're going to automatically broker that out to the entire transport network based on level of service, based on care, based on payer, based on specialties. Maybe it's somebody that has a ventilator, or maybe it's somebody that's bariatric, or they need to do flight services. Right. We handle that through the workflow and the expectation, and then we broker it out to the vendors that should be brokered out to. And then once somebody accepts that, and if we're connected to the right software with them and they've accepted, we'll be able to track like Uber and Lyft. We'll be able to see and get updates in real time when they're going to be there, what timestamps they're going to be there, being backed by Google, it's we can see now when we're going, when we're going to actually arrive, we do the same thing for our customers, and we're able to give that full transparency in the process. So yeah, that's really from just really ease and path both parties of being able to submit it, brokering it out, getting the information back in literally less than a minute on who's coming, and then making sure it's all tracked. So then the last part is just the accountability piece to it. We have the ability for dashboards that we've set. We've got reports. We connect to different systems that allow for the analytics so that now the hospitals who are beholden to the transport companies to provide them data, provide them reports. Now the hospital systems has those reports at their fingertips. They can help evolve their system. They can help evolve their performance. They can work transactionally and in real time with their vendors to make sure the system is moving appropriately. They can even set up, system-wide contracts, right, to be able to help with transport mode. So, and to make sure everybody's operating on the same sheet of music. So Ryde Central has helped solve those problems in the industry and really evolved the idea that you can take all this manual work and again automate it with everyone being on the same page.
Awesome. This sounds like really solving the problem. So, Todd, you were talking about the patient care record. So, are you guys deeply integrated with the EMR, EHR?
We're with Epic, we're with Oracle, Cerner, Meditech. We're with Point Click Care. We're getting great going to Matrix Care. We've been asked to go into others, and every day when we have different customers, we just keep evolving and growing with them. So if they're obviously not integrated, we have the option from a different portal and URL that we can connect them to, and they can still order. So we have a bunch of different options to be able to help create that vendor network and that connectivity.
Got it. And then you were talking about the GPS part. So do you guys offer a mobile application, or is it a web-based portal where I can see the real-time updates?
Yes. So the actual mobile application is going to be evolving and coming out with a little bit more, I'm going to say, ease of use here in the next few months. But that's one of the best parts is we've learned from our customers and clients. So we're updating that, but we can absolutely have a web version. The other neat thing I will say is, as you talk about mobile apps, nice part is we connect right with Uber and Lyft. And if, let's say, a nurse orders an Uber or Lyft for them to do transport, when they get notified, the patient can get notified, hey, your Uber's coming X, Y, and Z time. Once they hit the attestations and the right acceptance, it can actually function right in their app, or they can use the URL on their phone and they can see what's going on. They can track, they can have all the different, I'm gonna call it safety features that Uber and Lyft provide. All of that they can track right within the ordering. So you can see that, you can have what people have found as a normal day in life with Uber and Lyft. You have that as part of the application as well.
Got it. And how does the billing and ROI work over here? Like, do you guys charge to the caregivers, or is it just in the insurance part, or the end patient is being charged?
So a little bit on customer needs. So we do have some health systems that purchase us, and we do have some transport vendors that purchase us. So we have a bunch of different processes in which we work with. So we're very nimble. We have some health systems that share costs between the transport vendor and health system. So we're very fortunate enough to be able to be nimble as a company, but be understanding the market space, understanding we want to provide a very large return on investment for what we do for our customers. We just make sure that we touch on and or set up our ordering processes appropriately for them, and also work with them on what their needs are for billing. If you think about the hospital and transport world, it's very diverse in the way it's set up in its current state. And because it's so diverse, the payment models are kind of diverse as that. We have to be diverse and nimble as well as a company. So we work with our customers on that.
Awesome. Great. So Todd, let's talk about integration, AI, and automation and data. So based on your experience, Todd, what part we can be automated while keeping human involved in the critical decisions, and how important is that?
The automation part is key. And because what I would say is automation creates consistency. Consistency creates repetitive persistence. And once you get the consistency and repetitive persistence, people can become comfortable with something. 10, 15 years ago, I don't even know, it was that long ago now, we all were kind of nervous. Why would we order an Uber and Lyft and somebody that we don't know showing up, right? Well, it became easy, it became consistent, it became repetitive, and we became comfortable with it. Same thing here. So as we start talking about integrations, getting integrations set up that are easy, one button,
Mm-hmm.
one launch, click, and it's something that's easy for somebody to see, adopt, feel, understand. And then after they've done it once or twice, get the acceptance of, oh, I did get a vendor. Oh, they did show up on time. Oh, I did get to track that. Once they do that a couple times, that repetitive persistence creates that comfortability. So you have those pieces to it that we have found that because of the integration side to it, because of the automation, because it's consistently operating in the way that you set it up on, who the vendors you want to set it up to, what their expectation performance and how it's being sent out to the feedback loop, that whole process there creates a comfortability with all parties being on the same page, and you just get a widespread adoption, understanding, and again, getting acceptance with the process. So yeah, it's been good creating that ecosystem.
Got it. So where do you see the AI is providing the most practical value today? Like, is it adding value on the scheduling side, route optimization, provider selection, or predicting the delays, or any other areas?
So as Ryde Central, we haven't gone into the AI component yet.
Mm-hmm.
And honestly, the biggest reason why we haven't is every time we start talking about security reviews for health
Yep.
systems, they keep looking at you going, not quite ready for that. We've done more of automation in our process. We have been asked on doing different AI functions. What I think will ultimately come out with AI is going to come into maybe some of the front end ordering or back end, like resource management in the end on the other sides, until some of the logic comes and or comfortability with the security side to come within health systems. So, our scene to that hasn't really been the AI, but it is going to be transformative, especially on some of the decision making, some of the logic, some of the expectations here. I believe in the future that again can bring some of those pieces and parts that right now are more. I'm gonna say take some more of those transactions, some more of those straight line automation to be able to make some more clinical decision making on the either the onset or the output of it. So it'll be interesting to see where the market transitions to.
Got it. Yeah, I guess the security and privacy is a major concern when it comes to AI and automation. And stakeholders are a lot of concern about that part. And I totally agree with you on that part.
I always thought AI was going to be this adopted thing that everybody's going to be like,
Yeah.
that makes sense. It's going to run with it. Good, right?
Yeah.
With what we've started to learn to use on our day to day, how we ask it questions, how it helps us evolve. I mean, I'm doing stuff in my personal life and I'm always looking up our DIY. Is this the right way? Hey, this broke down. How do I fix it? Right? I do that on my personal life. I would have thought that part would become more intuitive, but from a security aspect, it really is something you have to pause and take a look at. And I will say that has been one of the driving forces that are driving things that we've learned as a company working with our health system and our customers that, hey, that's a risk factor of all of us. So that's why it's been easier to adopt because we don't go that route just yet.
And Todd, there are a lot of compliances as well. Like we have HIPAA compliance in the healthcare, and then we have other compliances depending on which niche we are working on. And everyone is like worried about that part as well, that they are not violating any of those compliances and they are staying compliant. So I think until they are fully sure that there are security guardrails and all the best security practices followed, no one wanted to go for the AI part.
Yeah, I mean, right now, I mean, with what we see, obviously SOC 2 examine, make sure you have all your reports going through those processes, being high trust, keeping everything up to date, doing your tests. I mean, all the different pieces, all the alerts if something goes off, like there's so many different pieces and parts of that to make sure that you're doing it. And I'll tell you, that's for me, I didn't come from the IT world. I did most of mine was management, frontline, or executive management, right? Coming into the software space, wow, there's a lot on that. And I know we spent a lot of time at Ryde Central to make sure we're read up and we're set right for our customers. And we even learn from our customers. We evolve even on feedback from them or from tests. So it's been a great learning for me.
I have one more point here. Does Ryde Central deal with the patient information at any stage? To me, it feels like it's a layer between vendor and caregiver just to arrange the transportation, right? Or do you guys deal with any patient health information as well at any stage?
Yeah, there is patient health information. That's again why we have to go through all those risks of security and compliance pieces to it. We do have to When
Hmm.
you're ordering, because you're part of the continuum of care. So if you think of the hospital, you think of the transport companies, that's all a continuum of care of patient safety, patient expectation, patient treatment, patient outcomes. All of that is all part of that chain of survival. As you start thinking about it, we transition a lot of clinical data and
Hmm.
demographic information because both parties need that information to either do the work, bill for the services that they provide. So, yes, we do transition and have to work with patient data.
So let's talk about the patient experience side. So should the organization digitize the existing workflow first, or they should redesign the workflow before adding technology?
So when you start talking about digitizing things, one of the things that we have done is we want to understand what workflows they have today, right? Because part of our understanding is knowing each health system might be set up a little different, and you can't put every workflow into one box or into one
Hmm.
streamlined process. As much as I would love to say every health system, every process, everything is the same workflow every time. We also talk about healthcare being your practicing medicine. It's not perfect every time, right? It's not the same everywhere, right?
Yep.
That's part of practicing medicine. Part of us is being able to be adaptive to some of those workflows. So what we've done is not only do we have our standard workflows that we work within, but we will evolve workflows. So let's say it's a brokerage, or we need to put hard
Hmm.
stops in for certain paperwork or certain approvals, or certain people need to be able to order and other people need to come back in and do specific work. Maybe it's notifications, maybe it's chat functionality. All of those pieces we really try to work through with our customers on evolving workflows. Plus, healthcare is not stagnant.
Yep.
What I've learned in being in healthcare for so many years is the idea that healthcare is going to be an evolution. And we as a company, the way we've structured our product is as those workflows, as things evolve, we can evolve with folks. So you can digitize a lot of things, or you can talk about some of the manual workflows that are there. But the nice part is we've got to not only digitize, we got to be able to put some of those workflows in, but we've also got to be nimble to, as medicine evolves, as expectations, as payers, as opportunities, just being able to evolve with our customers is key.
So, Todd, I was just looking at your website before this call. So I see that you guys provide solution to the hospitals, named providers, trip brokers, and then state and local agencies. For our listeners, can you tell us like what are these solutions, how they are differentiate, and what value they are adding?
Yeah, so when you start thinking about the different ordering process, like you have 911 companies that
Mm-hmm.
order out through exclusive operating areas to maybe some private transport vendors to help with low acuity calls. So really helping the municipalities. Or you have exclusive operating rights where ambulance companies own the entire market space and they have to operate in certain expectations. They are the primary vendor before ever being brokered out. Or maybe you're a hospital system that has 50 different transport companies that operate within it, and they have all
Mm-hmm.
sorts of matrix. Or you're a trip broker, so you're having to deal with MCO plans, or you're dealing with Medicaid. You're making sure those patients are have that right level of insurance to cover that trip, or they know what the cost is going to be. All of those are different workflows that are challenging in the industry that have been, again,
Mm-hmm.
fragmented for years. Right Central takes all those different offerings and helps the hospitals, the NEMT transport providers, the ambulance companies, the municipalities, the governments, whomever that needs to work through that, helps them evolve the transport and automate. Again, want to take all those transactional parts out, automate it to make sure all parties are on the same sheet of music. But that transitions into patient experience. If the patient's getting something timely, which we've seen a marked improvement in performance, when folks are late, they're late less time. We evaluate all of those moments. We are able to get that customer feedback and satisfaction, as well as making sure they may not be ending up with the bill and the right parties are ending up with the bill because all the insurance information was handled on the front side. So we try to make sure that patient experience is much more seamless, much more straightforward, plus a lot more transparent, like I was talking about earlier with Uber. You want that functionality to where they can feel something that's the same as they know. So if they're going home using Uber or Lyft, they can see it right in an app that they're very used to. And so those are the pieces for Ride Central, from helping to improve, from different markets, different resources, different company types, all the way through to the patient experience and what we try to provide them.
Right. Yeah, that's, I think, really helpful context. Let's have a quick rapid fire round where I will ask some quick questions. So, Todd, you can answer quickly whatever comes to your
All
mind,
right.
short
I
answers.
like I like rapid fire. They're fun.
All right, let's start. So, phone calls are automated alerts,
Automated alerts.
spreadsheet or centralized dashboard,
Oh my God, centralized dashboards, spreadsheets start to hurt my head.
biggest AI opportunity,
I think it's going to come when it comes to resource assignment and yeah, once hospitals get to adopt it and also being able to front end clinical information that's going to be able to be provided. But right now, not quite there yet.
one feature every hospital transport platform should have,
Ease of access, one click, one button, be able to finish it off in 30 seconds.
most common excuse for a delayed ride,
Not having your system set up and designed correctly.
one word to describe the future of patient transport.
Automation.
Great. Well, thank you, Todd, for quick answers. Right, so let's talk about the future of the Ryde Central. What is Ryde Central building towards next? Like, where do you see in next 5 years?
Really, the next 5 years is going to be really interesting. One part I would say with Ride Central, software to help automate patient transport. It's a new industry.
Right.
It's a new solution on the market space. What I find right now is I've spent a lot of time educating the customers on why this is going to be a good solution for them, right? Because you're introducing,
Yep.
it was like when Amazon, right? We all had to become comfortable with that, right?
Yep.
Same scenario for this software solution. What I find in the next 3 to 5 years, it's going to become the norm and it's going to become rapid adoption. And then from rapid adoption, it's like a product life cycle. You've introduced it into the market, right? Then all of a sudden acceptance in the market and it just rapidly grows. And then your customers are going to help you mature the product. And then there's going to be some evolutionary process in there. Is it, what is that going to be? I think it's still a little too early to tell. We've got a couple roadmap ideas on where that would go. But I think right now, the software is really in that product life cycle, really on that introduction side, and it's getting ready to hit that massive growth moment because it's going to become adopted. It's going to become the norm. And then once that happens, then it's going to mature. And then I think the market's going to dictate what that next evolution process is going to be.
Yep, that's great. And good luck with all these ambitious targets and goals that you guys have.
Yeah.
All right. So, Todd, what is one practical change healthcare organizations can make today to improve their patient transport?
I mean, I would be remiss if I didn't say just buy Ryde Central, we'll help you out. But one thing that I really think you have to do is you really have to look at your system in its totality. Okay, and what I mean by that is how are your contracts set up? Are they set up correctly? Or do you have the right terms and conditions, meaning performance standards, cost, payments? Can you centralize that? Do you have the right partners? Are they all on the same sheet of music? On the flip side, are all your people internally trained, educated, and handle transports appropriately based on all the rules and regulations that are out there? Again, all those transactional pieces that you have to deal with today that can be automated. However, part of that, what needs to happen within the healthcare organization just to prove is to make sure at a baseline, all your contracts are set right, everyone's on the same sheet of music, and everybody's operating as a system and not independently and honestly competing against the same finite resources that are out there.
Got it. Thank you, Todd.
Yeah.
Thank you for joining us today. It was really insightful to have this conversation, and I really appreciate your highlighted the patient transportation as a critical part of the healthcare journey.
Well, I appreciate you all having us today, and thank you all for letting us come on and kind of share not only a little bit about Ryde Central, but our journey, and talk a little bit about something we're passionate about. So appreciate everything you all do as well, and allowing us to be a part of the story.
All right, thank you, Todd, and thank you to the listener. We will see you in the next episode.
Thank you.